annex. Nobody went to inspect it. Every home must be inspected to see if they are run according to requirements of the law. Okay, so the next please. Do not operate a school or church in the same premises as the home. I told some people, if you have a school, I know you will benefit from your school. The school will help you, so we cannot say you should shut it down. But all we are asking is separate the home from the school. You can fence it. Let the children be alone. Let them be safe. Let them be alone. And then don't say it's a church. We have no. Separate your church from the school. Some people even bring their church CAC to come and register children's home. No, they are two different things. You register them separately. Respect the region. Chisom has already said that notice of change of proprietor premises shall be submitted to the ministry. So God forbid, but it happens. A proprietor or proprietress dies. What's next? The ministry should know, since it was that person that found the place, or I'm changing accommodation. The ministry should also know where you're going to. You submit so that your details will be updated, your data will be updated. Children who have age shall be interviewed to give information. Entry and discharge, proper profiling and records. Entry and discharge registers are compulsory. Personal files of children, photographs and data, including general medical history, date of entry, source, likes and dislikes, challenges, etc. Children who have age shall be interviewed to give information about themselves and their families. Records shall be complete, updated, confidential, and secure. For example, now, you have a child that is HIV positive. It's supposed to be confidential. These children, just like you wouldn't want someone to announce if you have HIV, the same way the children won't want anybody to know if they have such a disease. So we need to protect them from harm and discrimination. Okay, so submit copies of the registers, including staff inventory register, to the ministry quarterly. We say this even with our former commissioner, Honorable Inime Aguma, right in this hall, but we don't see it happening. We don't see you come with your reports and your registers. Immunize children between the ages of 0 to 5 years. Have a sick bay with a hospital bed, a drip stand, and a first aid box that contains supplies for treatment of minor injuries and medical emergencies. Employ the services of a qualified nurse to stay in that sick bay. Register with a nearby hospital for adequate medical care and emergencies. Child safeguarding policies must be in place. Every point is important, but a lot of things are happening in our homes, and we know that, and that's why I'm going to emphasize on this. Violence against children preventive measures must be in place. I said that because we hear of security men raping children in our homes. It ought not to be so. We hear of children being assaulted sexually by who? Adults do it to them, our workers do it to them, and then the children start practicing the same thing. So there's something we call preventive social work in social work. How do you prevent that abuse from continuing? So we have to take measures. Child safeguarding policies must be in place. Assign one minder to 5 children so that she can watch over them. Sometimes I wonder, when did that security man take that child out? And where did he sleep with her, have sexual intercourse with her? Where? How did it happen? Who wasn't watching? Who wasn't doing their job? So every caregiver and all staff should know and respect the rights of children, and that all forms of violence against children are prohibited, and anyone found guilty shall be prosecuted according to the law. Children in institutions or other forms of alternative care should know their rights and speak up when such rights are violated, and should also respect the rights of other children. They can only know and respect the rights of other children when they know their rights. Okay, so perform thorough background checks on minders, security men, and other staff. Where is your minder coming from? Who stood shorty for her? Even that person, let there be reference checks. Let them submit, let them fill a form with their full photograph, as well as passport photograph. So that because most of them, a security man has assaulted a child, has abused a child sexually, and he runs away, and we're not able to get him because we don't have adequate information on the security man or other staff. Okay, so identity and guarantor verification of all staff. Perform reference checks. Next slide, please. Okay. Forms must be filled with supply of relevant data, passport, and full photographs of staff. Set boundaries to prevent any form of violence against children. Set boundaries, set boundaries. Okay, so like I'm talking about like a male child shouldn't attend to a female child. Like a female child went to toilets or something, to ease herself. A male child should not attend to that female child. Because I've heard a case of a male child, in the process of cleaning, he was doing something else to the child. So we should set boundaries. Security men cannot go this far. Workers cannot go this far. This is how far they can go and all that. We should set boundaries. Okay, so training and retraining of staff on the rights of children and child safeguarding principles and procedures. Encourage child participation. Teach them safe practices and good hygiene. Enforce gatekeeping. Ensure that children who have lost or are at the risk of losing parental care receive the most suitable form of support and or care to meet their unique individual needs. Next slide. Ensure that alternative care for children is applied only when it is necessary and in the best interest of the child. Discipline. Children should be guided towards good conduct. Every residential facility for children should have rules and regulations to avoid a breakdown of law and order. All forms of corporal punishment, inhuman or degrading punishment or treatment are prohibited from in our homes. Have a timetable for activities such as eating, sleeping, playing, etc. There should be a duty roster for children to participate in keeping the facility clean, depending on their age. You can send them small errands so that they don't come out into the society useless. They will know how to do one or two things. Next, okay, leisure, recreation, and cultural activities. Chisom has explained to us that playing is the right of the children. A playground is compulsory for outdoor sports and games and should either be sandy or grassy for safety. Gymnasium for indoor sports if affordable. Outdoor recreational equipment like swings, merry-go-rounds, seesaws, trampolines, sandboxes, etc. should be on ground for children to play with. There should be access to modern leisure activities like board games, television, use of soft and hard toys. Talent hunts activities like singing, dancing, painting, drawing, football, etc. should be organized to explore the talents of the children because every child has potentials. So I'm saying this because most of the children in our homes are bored. They are bored. So the Bible says, there's a popular saying that says an idle word. And an idle mind is the playground of the devil. So things begin to run through their minds. So when you keep them busy like this with different activities, you achieve more and they achieve more too. So children are not expected to stay in residential facilities, popularly known as orphanages, into adulthood or forever. There should be a transition to independent living as they grow into adulthood. The plan should start at age 16 at most and should be personalized, identifying the strengths and specific needs of the child. Enroll them in a skill acquisition program for self-reliance, or you can call someone to come and do that from time to time. Empower them financially and morally after the need has been identified. Assist them with housing and starter packs. Involve their families in the aftercare plan and always follow up to see if plans are being actualized. Now, I said all this because when children are adults, we have children even in some of the homes. Adult children are now adults in some of the homes, and it's not good for the younger children. Those are the people that mostly abuse these children. They are now adults, and you're confining them in a place. So, way forward, we should move away from institutionalization because it affects the well-being and healthy development of the child negatively. Institutionalization is not in the best interest of the child because it leads to higher risk of exploitation, abuse, and neglect. And a lot of the United Nations organizations are advocating for this deinstitutionalization. I think Lagos State is taking steps towards it. We also should take steps towards it. So duty bearers should work towards practicing the kind of alternative care that helps the child while in family-based care by supporting children and parents respectively from where they are. Like Chisom said, if they need education, pay their school fees. Sometimes the children may need, the parents might need a capital to start business. Why not assist them with that so these children can keep enjoying the love, warmth, and bond of family? Okay, so the United Nations Convention on the Rights of the Child affirms that every child has a right to grow up in a loving family environment, and in 2019, United Nations General Assembly adopted a resolution on the rights of the child, which calls on states to transition away from institutionalization of children and strengthen family and community-based care. Conclusion: let all duty bearers work towards a sustainable practice that ensures the promotion of parental care, preventing unnecessary child-family separation, and protecting the best interests of the child for his or her welfare and total well-being. I also quickly want to add that in recent times, children have been missing from homes and all that. What do? We need to give their parents time. Some people came to our office. Groups of people have been coming to our office. Some have lost their children for 6 years. They are looking for them. Some for 10 years, some for 4 years, it just differs. So what do? We need to try and enforce this family tracing, family reunification, and integration thing. Thank you so much.